once people are knowledgeable, it shows that they're compassionate, they're understanding, they're mad about you. It's green flags from the very beginning. You get to talk about sex, desire, stigma. Like, you get to go deep into relationships and conversations from the very, very beginning. And now we're seeing women specifically get into relationships much easier with this message of can't pass it on. We're equipped with science now we just need to get in the big bad world, but we're more equipped now than ever to let HIV be less and less of an issue.
Hello and welcome to another episode of the HSE Talking Health and Wellbeing podcast. My name is Fergal Fox, and today we're speaking about the new You, Me and HIV campaign focused on HIV awareness and targeting the stigma related to HIV. So we'll be highlighting some facts about treatment in HIV and discussing some of the related issues. So it's my great pleasure to welcome some of the key people behind the campaign. HIV activists and hosts of the Poz Vibe podcast, Dr. Robbie Lawler and Veda lady, and our very own Professor Fiona Lyons, HSE Clinical Lead of the Sexual Health Programme and consultant in genitourinary medicine at St. James's Hospital. You're all very welcome to the podcast. I had to get
Thanks,
my mouth around that title, Fiona.
Be here.
So we were at the launch yesterday of the You, Me and HIV campaign, and it was a really powerful launch. I have to give compliments to you and all the people behind the campaign. But let's get focused on the campaign, first of all, the key messages, so that our listeners get to know what we're talking about here. Robbie, if I come to you first, what do you see as, the key powerful message from this campaign?
Well, there's so many, but let's get straight into it. As you say, I live with HIV. I take one pill a day. I have no side effects. It makes the virus go asleep in my body because I take it every day. It makes it undetectable. And it means I can't pass on HIV sexually. So I'm with my partner 11 years now. He's HIV negative. We don't wear condoms. I'm the safest person to have sex with. So he cannot get HIV. This campaign is a celebration of the scientific advancements, the medical advancements. It's just spreading that joy, celebration and knowledge to everyone around Ireland. There was a previous study that showed that 70% of people knew this fact. 70% of people do not know that we can't pass it on. We want to get that to zero. So this is what this campaign's doing, and we collaborated with the HSE. We have real people showing their face saying, I live with HIV, I can thrive with HIV, and you can too. So there's just so much about this campaign that I love, and I'm just so excited. We're finally here. It's 2025, and finally it's going to change what it means to live with HIV from this campaign.
Veda, what does it mean to you?
Well, for me, in a way, it means a personal victory as well, because I struggled with a lot of stigma, especially internalized stigma, when I received my diagnosis. Because I grew up I was a teenager in the 80s and the 90s, and I was bullied about HIV/AIDS from the minute it became a headline. As soon as it was part of our social consciousness, it was weaponized against me. I think, also I was around at the time when people were dying. I know people who died. And I knew when I came out on the scene as a queer man, as a young queer man, that there were a lot of missing faces because everybody that I met had lost someone. And it's just a sad environment, really, to have your rite of passage through a plague, essentially. So I carried a lot of shame with me about it, and it took me a long time to come out of the closet, almost 10 years. And for me personally, when I came out of the closet, there was nothing I wanted more than for other people to understand how unnecessary that was and what a huge mistake it was on my part to put myself in that position. I didn't have community. I didn't have support. I didn't have a best friend like Robbie Lawler. And luckily, I did have a husband who helped me to deal with it. I met him along the way on my journey. And, I live with HIV and I live with a Brazilian 15 years younger than me. So who's winning? No, but not to stereotype people.
Yeah.
But I think for me, the main message is that people living with HIV can speak for ourselves.
Yes.
We can represent ourselves. And really, that is the key to ending the stigma.
Yeah, exactly. No, that's beautifully put. And it's interesting, the layers that you're describing there about your own internalized homophobia initially, and then coming, your journey has been huge.
Yeah, there's more layers to it than a haircut in Tony and Guy in 1997. Did you ever have a haircut in Tony and Guy?
I did.
See?
And I should highlight to the listeners, this joy that you're hearing, it's really been infused into the campaign, and that kind of came out in spades yesterday in the launch. This is a joyful campaign, but it is addressing key damaging issues like stigma. And Fiona, if I can come to you now, the stigma that people have, that we know from research exists in relation to HIV, it's extremely important in the healthcare environment and in every environment that we kind of break those down, isn't it?
Absolutely, Fergal. And I think Veda hit the nail on the head there by saying, like, we have their voices. We have the voices of the people living with HIV. And since I started working in HIV medicine a long time ago and working with people when we had nothing, to having all the tools in our kit to keep people well, I had a duty to advocate for the people who weren't able to find their voice. I'm very happy to now share that advocacy with the people living with HIV. And lads, I'm also happy to hand it over to you in time because it's your voice. And I'm really glad that the voice has been found. And for me, it kind of sends shiver down my spine to think that here we are. We've got the people, they've found their voice. We can hand the mantle of advocacy over to them. And I'm really, really glad that's happened. I suppose for me, one of the most important things about this campaign is to make sure that for people who may be fearful of having a test or may be fearful of coming forward for treatment, please, we've got your back. We have the tools in our kit to keep you well. Your survival will be that of the general population if we get you early enough. You will not transmit HIV onto your sexual partners. You can become a parent if you so wish. HIV is not a reason not to consider parenthood. And finally, I suppose, one of the really big things that I want to see, and I think it was in spades at the launch yesterday, is how people living with HIV can live well with HIV. I'm going to share a tiny little anecdote without trying to steal the whole thing. But when I see patients in clinic, I do my Monday HIV afternoon clinic in James's. When I'm dictating letters to their GP now, I say, hi, X is 42-year-old gentleman living well with HIV. I've included the well. I've kind of wanted to make that message. It's a kind of small thing, but I feel really important about that because it's not just about having a good CD4 count. And addressing stigma is part of that journey of ensuring that our HIV community can live well and thrive with HIV.
And would you consider adding living La Vida Loca with HIV?
What language is that?
Just to really challenge the stigma. That's the hip jive that all the kids speak.
I think when I try to do hip jive, I will be setting myself up for an epic fail.
Me too.
Can I come back to you on some of those things? You were given a kind of overview of some big detail pieces there, but you were talking about the count. Yeah. You know, that somebody that's on treatment, that their count is going, that you can get their treatment down effectively. And so give us a bit more insight into what you mean by that. So
yeah, sure. So the two markers that we use for people's medicines working really well are, firstly, what we want to achieve is virological suppression. And the big breakthrough in that came in the mid-90s when we realized that we needed to trap the virus at different stages of its life cycle with different types of medicines used in combination. And when we did that and people take their medicine in a sustained way, we get sustained, what we call virological suppression. So the virus is down at such a low level that it isn't able to produce more virus, and it isn't therefore able to lead to the collateral damage of the immune system being damaged. So we in clinic will measure people's HIV viral load in their blood, which is a reflection of the virus in the body. Mm-hmm. And that our threshold in St. James's is less than 40 copies. The other marker that we look at is the CD4 count, which is part of the immune system. And all of us, our CD4 count is it 500 or above? Some people will have very high levels of 1200. And
this is your immune system?
It's part of your immune system. Immune system is really, really complicated. And I don't think we've got entirely to the bottom of understanding it. But how we measure how people's immune system is doing with respect to HIV is based on the CD4 count. Okay. So we would be concerned when people have a CD4 count of less than 200 that they may be at risk of infections that were their CD4 count higher, they wouldn't be at risk of getting. Okay.
So that kind of brings us into maybe an explainer that maybe people that are new to this area will need again in terms of HIV and AIDS. That, you know, that in terms of the terms that were used in the past and, you know, that HIV is what we're talking about here.
So HIV is the virus that can lead to, if left unchecked, can lead to people having a CD4 count that drops to such a low level that they may be at risk of opportunistic infections and then develop what we call AIDS-defining conditions. Okay. So there's quite a difference. And really with treatment now, we can avert people getting AIDS. People should never be referred to as AIDS patients or HIV patients. It's somebody living with a condition rather than naming them by the condition, like injecting drug users. It's people who inject drugs. As you know, our language really matters.
Mm-hmm. Yeah, it's not drugs to inject people. Can I ask you a question? When you do talk about someone, would you say like a late presenting patient, if someone turned up to a clinic and they were living with HIV without knowing it and they were having symptoms of AIDS, how should we describe them?
I suppose it depends on an individual level. I mean, I know that when we do our reports for reporting on our figures, we do use an arbitrary cutoff, a sensible cutoff of 350. And if somebody has a CD4 count of less than 350 at the time of presentation, we call that a late presentation.
Okay.
There will be some people for whom it isn't a late presentation, but there has to be some marker, and that's a sensible marker to do it. And that's not about labeling somebody. I would never say to somebody in clinic, oh, hi, you're a late presenter. But it's more to understand, because it's more to understand how we're doing in terms of our response and tracking our response at a population level to make sure we're meeting the needs of anyone who's living with HIV. But I would never, dear doctor, many thanks for referring this patient who is a late presenter. I would never label the individual. It's more a marker at a population.
You could just say a TV presenter, a little white lie.
Can I come back to Robbie and Veda about your relationship and, you know, your work on the Poz Vibe podcast, because that really has become a huge campaign in itself. Going on a couple of years now. Can you tell me how that's all set about?
Yeah, sure. I actually feel like I could take a breath. We've done so much media over the last while that I feel like I have to give everything in sound bites. Like I had to try and get all the information in 2 minutes. So I love long form communication. Between 18 to 21, I probably went to the George 3 nights a week. And my favorite night of the whole week was on a Wednesday night, because that's been Veda's night for the last 19 years or 20 years in the George. And I just loved
25
Veda.
years.
25 years. Wow. And so I always just idolized them. And drag queens are very much respected in the LGBT community. But like, let's fast forward a few years. We didn't really know each other. I just adored them. But when I was diagnosed at the age of 21 in 2012, I didn't know one single person out about their status. Not one. I said it was like living in a deafening silence.
Yeah.
And the hardest thing to do when you do it, live HIV, is live alone. And I had the best support around me, but I didn't feel like anyone really knew what I was going through. I felt like I was the only 21-year-old gay man to ever have HIV. I was like, no one's ever going to love me again. Or how do we even have sex? How do I tell someone on a date? Like, these are things you really have to navigate. And the doctors are absolutely incredible. But as a young 21-year-old, you have to navigate this world by yourself. It's a very scary world to do by yourself. So anyways, I decided that I have to break this kind of cycle of shame, stigma and silence, because no one was being educated. None of my friends knew about HIV, and they were all gay and out in the scene 3 nights a week with me, 4 nights a week. And we didn't know it existed. My previous sexual partners didn't know about HIV. No one knew about it at all. They didn't even know the difference between HIV and AIDS. I didn't when I was diagnosed. So I decided to break that by sharing my story. And I was banging the drums for a very long while. And I know there was other people around me. I just didn't hear of them. I didn't know of them. It wasn't until 2019, World AIDS Day, I woke up probably hungover one day and I look at YouTube and Veda came out about their HIV status through song. And I was like, finally something's going to change, because when a drag queen sings, we listen. And I feel like finally there's someone with a platform that's changing the game. Someone felt safe enough and defiant enough to feel that we can come out and we can make change. So we kind of connected over that. Then a few things happened. We were making a movie that's now available on Netflix. It's called How to Tell a Secret. It's available in Ireland and the UK. And myself and Veda really feature heavily in it. But at the same time, I was on the Tommy Tiernan show. So we kind of connected. We had chemistry, like, you know, filming together. The day after the Tommy Tiernan show, Veda came to me and said, Robbie, I had this idea in my head. Let's do a podcast where we platform the voices of people living with HIV. And I said, yes, let's do it. I just hope people come to share their stories. What can I say? I just thought it was a podcast. It was during COVID. You know, we were doing it in separate rooms. We have over 80 episodes and we have activists now who are happy to share their status, share their stories. And I really think it's because myself, Veda, and so many people said, let's share our stories, that this campaign was able to happen. And that's when the HSE works for community. I think it all happened so magically and it went so well. And I just keep going back to 2019, waking up, seeing Veda share their story. I was like, something's changing. And now it's like an avalanche in 2025.
So you knew this was needed. You had experienced that isolation and Veda, you had the inspiration around a podcast.
I did. It happened during lockdown because I was at home as well doing drag in my kitchen. I lived with another drag queen called Pixie. She's my daughter and she lived with me for 10 years. And during COVID, we were all in lockdown, so we could only entertain from our kitchen. A friend of ours, Viola, used to come over and she'd get in drag in the back garden so that we could observe kind of social distancing. And we did these shows, and I would get like 5,000 people watching the show because everyone's at home, like thirsty for something. So I would make sure I talked about HIV and HIV stigma. Because of that, I got a lot of engagement from people living with HIV, either in or out of the closet. And that's when I had been talking to Robbie and saying, there has to be something that we can do right now that would be a benefit to the community. And that one day the words pause and cast just came together in my mind. Instead of podcast, pausecast. And like Robbie said, he was on Tommy Tiernan that night. I hit him up the next morning thinking he might be like, you know, too big a HIV IP now for me to land him. But instead, you know, he was very enthusiastic. And I think it really took off because there was a desperate need for something. There was a void. There was really nothing going on. Very little support for people living with HIV, especially anyone trying to make change. So it just organically took off for us. People want to share their stories. And then there's this incredible bonding experience that happens with other people living with HIV when you share your story. I'm lucky, for example, that my therapist lives with HIV, and that saves me so much time and so many doubts in so many scenarios because I know that's just not a thing for him. His judgment of any situation is just like mine. It's not like he thinks in some way he's lucky or less stigmatized, but essentially, though, I don't feel judged by him for that reason. And I think the most important thing that came out of the podcast was really the tribe, the friendships that we built through that commonality. We're passionate about each other. And it used to feel like a peer support group and that Robbie and I were giving support just because we had a little more experience. But my goodness, have they caught up? You know what I mean?
But the great thing about the podcast, or like I've been dipping into a few of the episodes, and I want to just give you huge compliments on it because you asked me last week, Robbie, what's the tone of this podcast? And I was thinking about what's the tone of your podcast? You know, the Poz Vibe podcast has such an uplifting, positive tone. You know, you're bringing it here in the recording today, but
thank you.
You bring it to every episode. And when you sit back and think, oh, you know, that two people wanted to do a podcast about HIV awareness and they want to do it in an uplifting, entertaining, an engaging way, and you're able to reach people around the world nearly. I know that you've created a community in Ireland, but it's just so impressive how you've used a podcast to do what you've done. Compliments.
Thank you so much.
It's more than a podcast. I call it a movement.
Yeah.
It is a movement.
No, it is.
And it's also a resource because people who are recently diagnosed with HIV, again, as I said, the young 21-year-olds didn't know who to look or know anyone. We were talking beforehand, the podcast is a very private experience. They can just put their headphones in, walk the dogs, and they can feel that they're part of a community until they're ready to be part of the community. And I think it's such a really healing thing to give new people living with HIV. And we get messages all the time. Like, I got diagnosed 3 months ago. I listened to all your podcasts within 2 days. And now that I digested that, I really want to meet you for a coffee. And it's just such it's so rewarding. It's such a rewarding thing. So it's more than a podcast. It really is so much that we give people.
Can I just come in and just say, I mean, what I'm really struck by what has happened in the world of HIV and what the guys are doing, what others are doing around bringing their voice forward, like that needs to be done in so many other areas of health. Like we all have something. I'm a middle-aged menopausal woman. I've listened to listen to podcasts about the menopause. Yeah. You know, it's and I've had tips from my hairdresser, tips from colleagues, tips from friends. Sharing our lived experience is such an important part of informing ourselves and making us feel okay and not making us feel like somebody who's isolated when I hit 51 and a half and all of a sudden my world started to fall apart. Actually, there were people who were having the same lived experience. So there is massive value beyond this campaign. I think it'll deliver in spades for the HIV community and for those of us who are affiliated with the HIV community. But there are lessons to be learned for every other aspect of health as well, because our shared experiences for anything are so
it's
important.
Interesting that you say those couple of issues, because some of our most popular episodes are when we have people talking
about their own experiences
and obesity, menopause, some of these things that are stigmatized or there's a lack of knowledge about. Yeah. You know, they get peak engagement on our podcast, interestingly enough, because there isn't enough content out there. Sorry, Robbie, you come in.
We can't wait to be your number one listen to podcast.
Here we come. We'll put them under pressure. Yeah. It's the old Jackie Charlton.
We're so happy you said that, Fiona, because we have so many people saying, I don't live with HIV, but I relate to so so many different aspects of your podcast, and you hit the nail on the head, because stigma and shame are universal emotions, right? Everyone experiences that in loneliness for whatever reasons at different parts of their life. We have people who have mental health issues, for example, or body dysmorphia, gender dysmorphia, for whatever reason that they might not feel maybe accepted by their family. They have a secret that they feel they can't quite tell. Everyone gets something from it, and they hear all these hard-hitting topics, but brought in with the joy, brought in with the connection and the importance of connection. So the podcast has really got legs, and it travels around the world, as you said. There's an appetite for this sort of connection, even if it is just two queens with a microphone and gorgeous people in the community. That's what people want to hear to try.
Yeah, I want to talk about, like Fiona, going back to the issue that you said there about the voices and some of the other people that are taking part in this campaign. Robbie and Veda are, people are going to see them on the television and the ads and hear them on the radio, hopefully. But Aoife Cummins and her dad, another two powerful advocates, and I met her dad and Aoife for the first time. I felt I'd met Aoife before because she took part in the podcast with Eamon in November 2023. It was episode 32, I think, if people want to go back. And she did a lovely conversation about her own diagnosis and coming to terms. And Fiona, you were part of that. So it's really great to have a diversity of, people from the community represent, isn't it?
It's not an accident either. We talked a lot about it and what stories to start with, because this is just the first part of this campaign. We're going to platform more stories in this collaboration with the HSE. And we were tactical, I think, and smart about it. Robbie and I are passionate about femmes and women and wanting to uplift them in the space, because it's the space that's not only dominated, like most things, by men a lot of the time, but in this case by queer men, because we're lucky enough to have worked hard enough for a long enough time to free ourselves of the shame. It's just our job to open the gate and lead other people through, I think. And in this case, it was a real honor to have Aoife and Ionara be part of the campaign. I feel like Aoife and Pat really speak to a demographic and a story, tell a story of parenting and how we want to protect our parents so much from stuff like this. And also of just Irishness and daddy and tea at home and just loveliness.
One of the things that I picked up on was listening to your own podcast with Aoife was that how, and it kind of relates to the Netflix piece as well, how to tell a secret, is that a lot of young people figure out how to keep a secret from their parents. Yeah. And I think, Robbie, you were talking about going through kind of coming out and and keeping the secret for a while yourself, that, and then this is another secret I have to keep, and that it's like you said earlier, Veda, about the layers to the experiences.
As a parent of three gorgeous young adults, like from the moment my first child was born, it was like I was immediately in love. It was like unequivocal, didn't matter. All that ever matters is the welfare of my three beautiful children. They'll always be my babies. And so to anybody out there who feels that they need to keep a secret from their parents, for the most part, our parents are just like Aoife's dad, absolutely stone mad about his gorgeous Aoife. Yeah. And parents are like that. It's just the most important thing is the welfare of your child. So actually, and secrets can be bad for us. Secrets are hard. They wear you down. So it's often not half as bad as you think by sharing those secrets. So take a risk. Come on out.
And Aoife's story, how she kind of shared it with her dad, and then, a while later, the dad comes in asking her, does she want a cup of tea? And she knew that was the bubble burst on the tension between them or whatever it was.
Exactly.
And you had a similar experience. Well, not similar, but like your piece about your mother, wanting your mother.
The power of a cup of tea, that's all I can say. Actually, I had to give a talk in a church, St. Peter's Cathedral in Phibsford. You asked me in, so I was in front of a Monday night congregation, and it was one of the best talks I've ever given. It was the power of a cup of tea. Now, I didn't want to go into like the nuts and crannies of unprotected sex or whatever, STIs, but it was about unconditional love from your parents. And yeah, you're right. The minute I got my diagnosis, I brought my mum straight in, and my mum was my rock from the beginning. And I say this story all the time, like when I was going home from the clinic, I was like crying my eyes out, and I just turned to my mum and was like, "Mum, no one will ever want to love me anymore." And she was like, "Well, I love you," in just such mammy terms. And she's like, "Whatever happens, we'll get through it." And just having that one person was amazing. I never thought my mum would think anything of stigma or shame, to be honest with me. I never even entered my brain because we're just so close. I knew she'd have stigma or shame if I never told her. She'd kick me up the bum, like, what I mean? She'd be raging for that. But we hear this time and time again, Veda, about parents, right? And I think that's why Aoife and, Pat's story really resonates with so many people living with HIV. We feel like our parents won't understand. But they also don't understand if your child's gone through a chronic health condition or whatever it is and they feel they can't tell you. That's why they feel hurt a lot of the time. They also feel protective over their children. So they're like, keep it quiet because they don't want harm to happen to you. But we have to have a lot of forgiveness for our parents because they know they're a different generation. Don't take the very first reaction as gospel. Give them time to come around. Let them educate themselves. And as Fiona says, all you want from your children, now I have 2 dogs and they're my children, and all I want to see from my dogs is that they're happy and healthy. So I imagine as a parent for kids, you want that as well. So once your parents can see you thrive, get on with life, take that pill a day, have your families, just have whatever your life will be, that's what parents will finally come around to. What we try to do in the Poz Vibe is say, if it's initially bad, you know you have the community backing. You have us to give you that love and that support when you need it until your family come on board. But 99% of the time, and we've heard many stories, parents are grand. We actually had one guy called Patrick. He doesn't mind, he was on our podcast. He told his parents after 20 years of not telling them. And they were like, yeah, sure, we seen it on EastEnders last week. That's fine. Because it was a storyline of HIV in EastEnders, and he kept it a secret for 20 years and this man couldn't give a crap.
Do you know what the best part about that story was for me? That a week later, he was back down the country visiting his parents, and his mom said, sorry, Patrick, can I just clarify? You did tell us you were living with HIV last week, didn't you? Because she wasn't even sure if he was, that's what he was saying, or he was just talking about it in general.
Just talking about Coronation Street, EastEnders, or whatever.
Yeah, one of them.
Which that was my favorite. Like, he had this euphoric week of I've told them. He comes back and they're not even sure.
And would you stick the kettle on there, love?
Exactly. And put the tea on.
I want to mention and appreciate A&R as well in terms of because like
the goddess,
like a lot of bravery there as well in terms of why she initially came out around the getting IVF and so like you have a collection of advocates and spokespeople that are so powerful. That's why I thought
a team, like actually a few handfuls, a small league more as well. Just to be fair.
Benches
so
deep.
many amazing people. We started off with a handful, then maybe we got to a team, then a few teams. So now I'm going to say a Justice League. You know what the Justice League is? Except more diverse than the Justice League and maybe more powerful.
Yeah,
really.
but the term that I heard used yesterday was the tribe. That you pulled in, using the podcast as a medium, but it's a movement and a support network. And when you need your support, or when you need to listen to somebody that is going through something that you might have gone through, or you're going through now, you have all this content ready made as a kind of, a supportive. It's beautiful.
Can I just say something about INR and Peter and why I find it just so impactful for the people who we know living with HIV? The other thing about living with HIV is, how do I tell this someone I'm going on a date with? You know, and everyone has their different strategies. And a lot of people isolate themselves or don't want to go dating for many different reasons. And I just think seeing the love between Peter and Ainara, and he just said from the beginning, I just fell madly in love with you. It gives you hope that, your Prince Charming's out there, or, that you can find this gorgeous bride if you want to. It doesn't matter. We might have to kiss a few frogs before we find the Peter in our lives. Yeah. But Ainara, I think it's such a gorgeous thing to reinforce that we are lovable. We deserve to have the passion, the gorgeousness of their relationship, their marriage now. I remember when I was doing the dating scene, I found it extremely difficult because I had a 5-date rule at the time. That was my own personal way, because I wanted them to get to know Robbie rather than tell them on the first date saying, HIV was the the overarching thing of my life. And I remember saying it to Morris, my now partner of 11 years, saying, I really never want this to be one negative thing in a relationship. Not once, because we hear time and time again how sometimes it can be. Yeah. And it's how it's difficult in a relationship. And I didn't want that because I know my HIV affects no one. And Morris just said, well, it's one extra thing I'm going to learn to love about you. And we're 11 years since. And, Veda's in a gorgeous relationship now. And we just need to hammer home that we are lovable, that we deserve to be in a healthy, strong relationship. And HIV is the best filtration system in the world because it gets rid of the riffraff who can't even get inside their own head. Once people are knowledgeable, it shows that they're compassionate, they're understanding, they're mad about you. It's green flags from the very beginning. You get to talk about sex, desire, stigma. Like, you get to go deep into relationships and conversations from the very, very beginning. And now we're seeing women specifically get into relationships much easier with this message of can't pass it on. We're equipped with science now we just need to get in the big bad world. But we're more equipped now than ever to let HIV be less and less of an issue.
You reminded me of Peter's voice when you were asking him, and he said, like, it was nearly like her vulnerability telling Peter, that's, he just fell in love with her. Like using that vulnerability, it was just like, oh, this guy just fell head over heels.
Oh, the day the videos for the ads were being filmed, like, I mean, it was almost kind of sickening. Watching how in love they are. It's sickeningly gorgeous.
Yeah.
If you know what I mean. How in love they are.
Yeah,
it's just puking. Gorgeous.
Yeah, it's really gorgeous. What even I aspire to be. I'm like, Morris, you need to your book up.
So you've been partners in the development of this campaign, working with HSE campaigns, and give a shout out to all my colleagues in programs and campaigns in the HSE. We heard from Ina yesterday, and I know Myrn has done a lot of work on this, and different colleagues across the HSE comms. But so it's I suppose, I know you've referenced earlier on, Veda, but this movement that you've created, like the HSE is like, we're going public with this now. You've done a lot of work. You've done a lot of work on the target groups over the years, but now we're actually going broadcast, mainstream.
Yeah, like I have to say, it's been a journey for us and the team in the HSC. I absolutely love them. I don't care if that's professional or unprofessional to say. I'm obsessed with Ina and Miran. And with Amanda who does the PR. Some of the best PR I've ever seen, especially for HIV. The press releases are immaculate, but especially them having our backs and really allowing us to be ourselves, to be a little bit confrontational sometimes, a little bit sensitive, because it's a journey for us too, but really just being consistently amazing allies. And I think what's been incredible about this is we didn't start off using words like collaboration. Yeah. And we didn't start off with them saying, here's the reins. Mm-hmm. But as soon as we got to a place where they could give us the reins and use those words and celebrate us, they were so keen to do that. And it's just one of the proudest moments of my life, what we've managed to achieve with this campaign for the tribe, not just for Robbie and I. To be honest, Robbie and I weren't looking to be the faces of this campaign. We were actually looking not to be, but we, through the encouragement of Miran especially and the HSC, came to understand that the best play was for us to be the faces partly of this campaign because of our resources, our documentaries, the podcast. But in return for that, they have agreed to platform many more voices in an online campaign that we're beginning pretty much any moment now of the rest of the tribe, because we want to represent everyone as diverse as possible, as individual as possible. Every story unlocks one little piece of stigma, not just in the person telling the story, but in at least one other person who hears it. And that is how we do what we do, slowly. One story at a time.
Can I bring, sorry.
No, go for it.
No, Fiona, I was going to ask you about that kind of, that public awareness of what the public need to get. Like, a lot of people have heard, because of your tribe and movement, a lot of people in that area or in that community have heard your U equals U. We haven't even explained U equals U.
Shall we?
Shall we better? Yeah. Robbie, you go for it.
So U equals U stands for undetectable equals untransmittable. And basically it means, I remember I said at the very beginning of this podcast that I take one pill a day and it has the virus basically asleep in my body, and I continue to take it every day to make sure it stays asleep. But because it's asleep, I am untransmittable. So the HIV is undetected when we look for HIV itself, and it means I can't pass on. The risk is zero, and we can have kids without fear of passing on HIV. So that's what U equals U stands for. U equals U is more a movement. It's a banner that all these activists around the world is saying, because it really empowers people, one, to get tested, and two, to start treatment and stay on treatment. It's such a game changer from a public health perspective. But personally, it just makes us feel so good. And I see it on a mug here right beside Fiona.
Fiona has a U equals U mug from our local coffee shop, Marlow. Robbie and I do all of our meetings, most of our meetings there, and they're incredible supporters. And they got these mugs made for Christmas, and they are just gorgeous. And Fiona happens to have one.
I was a very lucky recipient of a gift of one of these U equals U mugs from Clara O'Flaherty, one of the Registering Guide, and it's my favourite mug right now.
Yeah.
Can I just make, because I don't want to bypass this, allyship comes in many different forms, okay? So everyone can talk about you because you or can't pass it on, or they just talk about the advancements of HIV to their granny, their sister, their auntie. It doesn't matter, right? That's all allyship. But then you have these very local businesses, like our local coffee shop, putting you equals you on a mug, and they won a van in a competition from Ford, and they painted you equals you on the van that they literally just bought, a coffee van. This is true allyship. Small businesses or just very individual ways of spreading the message and challenging and debunking myths from the 80s and 90s that are still so prevalent. And that allyship comes in like a rainbow of forms. And just to see our local coffee shops sell out of Yucca mugs, it just energizes me in a different way.
It's unbelievable, yeah.
Mm-hmm. So Fiona, in terms of the public awareness message, you must be delighted to have the people you have behind the campaign. As Veda said, we're more on the way. But in terms of health service staff, like I didn't mention that Aoife is, or people may know that Aoife is working in healthcare. She's a nurse, and Einara is from a healthcare background. It's something that she says.
And Pat, oh
yeah, Pat was working in Galway as well in healthcare. So, but in terms of healthcare staff, it's even more important. And anybody working with people, I guess, that's us all in some case that we get this message, isn't it?
I mean, you're absolutely right about healthcare staff. And unfortunately, there's really good research that has shown that stigma, that people living with HIV experience stigma and negative encounters in healthcare settings. I was listening to some of the podcasts in the run up to the campaign launch, and one of the podcasts talked about somebody having a very negative experience with a nurse in the hospital that I work in. And I was out doing a power walk and I stopped dead in my tracks going, not in my hospital. This couldn't be happening. So I guess what we need to remember is, and Robbie referred to this with the interview with Pat Kenny yesterday, he said, it's human. We're all humans. None of us is perfect. I'm practically perfect. None of us is perfect. Yeah. I was at Mary Poppins last week, so that gives me license to say that. But I think none of us is perfect. We need to remember that we may have colleagues who are living with HIV as well. And I had an experience, and I shared this at the launch yesterday, where many years ago, not in Ireland, working with somebody who sadly lost their life to HIV, we did amazing work with our shared patients, but that person never felt okay about coming forward for treatment because of stigma, shame. And I just hope to God that I never ever said anything that would have meant that my colleague didn't feel that it was okay for them to come forward for treatment. And I say that a very strong message out to colleagues working in healthcare. Our words really, really matter. How we refer to people really, really matters. And at the end of the day, we're all just human and none of us is perfect. And we all have our bits and pieces that makes up who we are. And so, in the other healthcare setting, we need to debunk the myths about, Aoife talked about, people, like a very casual conversation about somebody saying that they would wear gloves if they were caring for somebody living with HIV. Why? That is so unnecessary. Everybody deserves to have their hand shaken, to, have a hug. And regardless of whether or not somebody's on treatment, that is not a risk. Double gloving, last on the list, all those very stigmatizing things that are not necessary. We operate in universal precautions. That's what we must do. From the very first day we set inside a hospital setting, that's what we operate, using universal precautions, and they apply universally. And and just in respect of healthcare workers living with HIV, the guidelines for healthcare workers living with HIV undertaking exposure-prone procedures where there may be a transmission risk by virtue of the invasiveness of the procedure are being updated now and I'm very glad and happy to be part of that, where they're being updated to mean that the people living with HIV will no longer be excluded from doing exposure-prone procedures because they shouldn't be excluded.
Yeah. Mm-hmm. So as we kind of come to the end of this podcast, I just want to ask the three of you individually now your hopes and wishes for the future, because we've come a long way. Like that's, I think, part of the joy in this is like Veda, you celebrating where, the country has come from. So hopes for the future. What do you think?
I want to end HIV stigma. I want to end new HIV acquisitions. I think because of PrEP and PEP, condoms, lube, and especially because of U equals U and the free at-home testing, Sexual Health 24, you can test at home for HIV and a whole other selection of STIs. I think we have everything we need to get there. The biggest barrier is and remains to be stigma. Yeah. So I feel like as a tribe made up of such an incredible diverse group, there is really nothing that we can't and won't do with our creativity, our love, our energy to destroy stigma and just continue on that journey. But I think, within the next decade at least, we should be able to put ourselves out of business. That's what I want to do. I want to put Robbie and I out of the HIV business.
That's good. That's a good wish. Fiona?
Well, Veda's just said everything I wanted to say, actually.
But he did.
That's my job.
That's okay. But I guess, I suppose I have some, you're looking into the future, I have some short-term future things that I'd like to see. I would very much like to see that this campaign changes the public opinion, obviously addressing stigma, but also on a deeper level that actually if this means that one less person has to go through a traumatic journey, either to getting their test or to living with their diagnosis and getting on treatment, then that would be a dream come true for me. That, that we manage to get people have the opportunity to look after them earlier. That would be a dream come true for me. And in the long term, again, a little bit like Veda and Robbie, I'd like to be put out of business, that there's no need for me as a HIV physician. I love looking after HIV. It's a fascinating area of medicine, but ultimately I would kind of like to be put out of business.
And Veda also mentioned some of her own services that you've been part of setting up in terms of the testing. And I know that in terms of your work here in sexual wellbeing and with colleagues, that there's a new sexual health strategy hopefully coming this year very soon. So there's a whole context there, isn't it? Like the revolution has really started, but there's more to come.
There is more to come. And I suppose, the Late Late Show first broadcast in 1962, and some people would say that we didn't have sex in Ireland before the Late Late Show, but we clearly did. And we just didn't talk about it.
Straight away afterwards.
But 2015 was when our first national sexual health strategy was launched. And that came at a time within our society that we just kind of became a little bit more human as well. And we made big advances in sexual and reproductive rights for the people living in Ireland, for all of us. And I guess the launch of the Home STI Testing Service is giving people agency. The purpose of it is to break down barriers of stigma and shame, give people agency, self-advocacy and control and convenience. And it also works from a financial perspective as well. And I'm very grateful to the resources that have been put into making that work, and it's available all over, and it's continued to be a really good service into 2024. With the new sexual health strategy, what we want to do, hopefully I'm not speaking prematurely, but the vision is to build on the gains that we've made since the launch of the first strategy, with the establishment of the HIV PrEP program in 2019, the establishment of the Home STI Testing Service. We need to make sure nobody's left behind with those services, and that's hopefully, and ensure that there's equity. Equity is a very important part of the second sexual health strategy, and hopefully I don't get into trouble for saying that, but I think it's reasonable because it hasn't been launched yet, and it's not my job to launch it either.
Yeah, but you're a key part of it, absolutely. And I look forward to seeing that later in the year. Robbie, last but not least.
Well, we have a deadline to be out of a job, and that's 2030, because UNAIDS set targets for zero new HIV infections, zero AIDS-related deaths, and zero stigma and discrimination by 2030. And as Veda said, we have all the tools. We have the biomedical tools, we have the education, we have the knowledge, we have the science to make this happen. We need political will and we need funding. The reason why I'm so happy you ended with equity there is because I work in Access to Medicines Ireland. I'm on my 6th option of HIV treatment because I had various side effects for different ones. And it's just like with the contraception pill or mental health tablets, you find the right one for you. I could probably go on my 7th or 8th if I want to. But my friends in Zambia or Uganda probably only have access to 2 or 3 most. And the thing is, when you go into second or third line treatments, they get more and more expensive. So in resource limited areas, that's a very difficult thing to do. So why should I be able to go into new medications, but my friends can't? Why is there more value placed on my life than my friends in Uganda or Zimbabwe? So I set up Access to Medicines Ireland, and now people largely around the world have access to treatment if they want it. It's such a huge success story. But it wasn't previously. Between 1996 and 2006, generic drugs, HIV treatment that was available in high-income countries weren't allowed in sub-Saharan Africa. They were blocked by the pharmaceutical industry. So an estimated 9 to 12 million people died needlessly of AIDS. Needlessly, purely due to greed. Now, access to medicines is one element, there's many different elements, but now we see how HIV is such a big issue in sub-Saharan Africa that we're trying to get a hold on now, and we see amazing things from Rwanda and Botswana of how they are reaching those targets, even better than Ireland, I would say. But inequities exacerbate pandemics. We know this. So let's just talk about what's coming in the future biomedically. And this is how we're going to end. It's a big part of the jigsaw, a big part of the puzzle of how we're going to end HIV. Long-acting injectables, right? So we know we use long-acting injectables for many different health areas. So it's one injection and it might last you for 6 months rather than taking a pill every day. We have that now for pre-exposure prophylaxis as a HIV prevention drug. And we have it for treatment too. So instead of us taking a pill every day, we can get an injection every 2 months, or the drug that's coming in the long term every 6 months. So imagine this. Instead of someone going to the clinic every 3 months to get pills to take as prescribed, and we know people aren't great at taking pills when they don't have a health condition as well, right? Adherence can be an issue. We give them an injection every 6 months. It's almost 100% effective. Now, we're still waiting on the research to still come out. People aren't going to have access to this, especially in areas that they want to. So imagine this drug that can end your HIV infections is not going to be shared widely around the world. And the company that has bringing out this drug specifically has done license agreements with low-income countries, but not middle-income countries. And middle-income countries is where we're seeing a rise in HIV infections and transmissions. So why are we living out the people who need it? Why are we allowing the marketplace to decide when this pandemic ends? And mostly, people in Ireland won't have access to it because they're definitely not going to do it cheaply. And for Ireland to be able to afford the 6-monthly PrEP, it has to be on parity for what oral PrEP is, and they're not going to do it. So we really have to mobilize to make sure that it's affordable and accessible if we really want to reach our targets.
So it sounds like you started your next campaign in terms of, and the health equity is your focus in terms of the...
Well, unfortunately, one person died of AIDS every minute last year. Yeah. When they don't have to. That's the problem. So the more interventions, the more options we have for people, this shouldn't happen. And money shouldn't be a problem, not when it comes to public health. So we have to fight.
Okay, well, look, I want to wrap it up today. I really want to just express my huge appreciation to Veda and Fiona and Robbie for coming in today and sharing. You know, like we got lost in the conversation there a couple of times, but you really were so expressive and engaged. And it just, it's really great to have you into the podcast on the back of this campaign. I wish you all the best of luck in the campaign.
Thanks so much.
Much appreciated.
Thanks, Fergie.
For further information, Fiona, the information on the HSE website is at
www.hse.org/HIV. There's also information on the sexual wellbeing website as well.
And the sexual wellbeing website is great for more information about the other things you were talking about in terms
PrEP
of
and the home STI testing service. Yeah.
And we have a pozvibe.com website. We are on Spotify and iTunes, and you can also find us on the socials, Instagram, Poz Vibe Pod, or on X as well. We're Xy and we know it.
Very good. So to the podcast listeners, we'd just like to thank you again for your support and listening to this podcast. If you think you'll find anything useful in this, please share it with somebody that would appreciate the content. And thanks for listening to another episode of the HSE Talking Health and Wellbeing podcast.